Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Here I have a group of my mentees. They are going to present a group discussion about the infrared radiation for a condition called osteoarthritis, which is an inflammatory condition. So now I am over to the students who are going to share the valuable information about the infrared radiation treatment for the osteoarthritis patients. Yes.
Hi everyone. So today in our group topic discussion is the uses of infrared radiation and its management in osteoarthritis. So infrared radiation is commonly used in modality in physiotherapy and rehabilitation for pain relief and improving joint mobility. So during this discussion, we cover definition, principles, indications, contraindications, physiological effects and clinical applications and limitations. So let us begin with what is infrared radiation. So infrared radiation is an abbreviated form of IRR. In the form of electromagnetic radiation with wavelengths and ranging approximately from 760 nanometers to 1 millimeters. So it lies between the visible light and micro-ovens in electromagnetic spectrum. In physiotherapy, infrared radiation is primarily used for superficial heating modality. So before discussing the treatment, let us have a brief discussion about osteoarthritis. So osteoarthritis is a degenerative disease which is characterized by the joint disease, which is gradual breakdown of articular cartilage and the narrowing of joint space, which is causing pain, stiffness and reduced in mobility. It is commonly affects weight bearing and joints like knee, hip and spine.
Yeah, osteoarthritis and its basic features. Usually it will affect the major joint. Specifically in our Indian population, osteoarthritis mostly affects the knee joint. So let's see in what principle the infrared radiation works for those patients.
How does infrared radiation work therapeutically? Radiation transfer energy to tissue through electromagnetic waves. When the rays are absorbed in skin and superficial tissue, they are converted into heat energy. The depth of infrared radiation is around 1 to 3 millimeters. Therefore, it mainly heats the skin and superficial tissue rather than the deep structure. It increases the temperature, produces vasodilation, it improves the blood circulation, enhances the oxygen delivery and promotes the tissue metabolism. These effects contribute to pain relief and muscle relaxation. So, infrared radiation therapy is essential in the form of superficial thermotherapy to help to reduce the symptoms associated with osteoarthritis.
So these are the principles that infrared radiation therapy works for the osteoarthritis patient. So who are all can get the infrared radiation and who cannot get? What is the indication and contraindication?
So infrared radiation, indications for the infrared radiation are osteoarthritis, chronic joint stiffness, muscle spasm, chronic low back pain, soft tissue injuries, preparation before exercise therapy.
Yes, what are the contraindications?
Contraindications are the areas with impaired sensation, acute inflammation, active bleeding, malignant tumor, severe vascular disease, areas with poor circulation and directly over the eyes.
Yes, so in these conditions you have to avoid giving the infrared radiation therapy. Okay. So what are the physiological effects we can get from the infrared radiation?
Okay, let us discuss about the physiological effects in more detail. The first effect is vasodilation. Vasodilation is one major effect in physiological effect of these infrared radiation. Heat causes blood vessels to widen, increasing blood flow to the theater area. Improved circulation helps to improve the metabolic waste products and supplies nutrients necessary for this tissue repair in this system. The second effect is pain reduction. Infrared radiation can reduce pain by stimulating thermoreceptors in the skin. According to the gate control theory of pain, thermal stimulation may inhibit pain transmission to the brain. The third effect is muscle relaxation. Heat decreases muscle spasm and promotes relaxation of surrounding muscles. This is particularly used in osteoarthritis patients where protective muscles guarding often develops around the painful joints. The final effect is improved joint mobility, reduced pain and increased tissue flexibility help improve range of motion. This allows patient to perform functional activities more comfortably.
Yes, so what are the other things we need to know in clinical usage?
Now we can see a clinical application in OA by using an infrared lamp. First, we can expose the affected area by with comfortable position to the patient. The lamp is placed approx distance 40 to 75 centimeter to the treatment area, and the rays of strikes at 90 degree to the patient for maximum absorption. And the treatment area range from the 15 to 20 minutes for patient to tolerate and comfortable. During treatment, the therapist should monitor the excessive eating or bones like and erythema and skin redness. Following infrared therapy, a patient can also combine with stretching exercise, strengthening exercise, and along with range of motion exercise to improve the functional ability.
Yes, what is the conclusion?
The conclusion is first advantage and limitations. Let us evaluate the benefits and limitations. Advantages: non-invasive treatment, easy to administer, cost effective, provide pain relief, provide enhance patient's comfort, useful for before exercise. Limitations: limited tissues penetrations, temporary symptom relief, does not reverse cartilage degenerations, requires proper patient's monitoring, not suitable for all patients. Therefore, infrared radiation should be viewed as an adjunct treatment rather than a standalone therapy. Then, evidence and the clinical relevance. The question is, what does current clinical practice suggest? Research indicates that superficial heat modalities include infrared radiation can help reduce pain and stiffness in osteoarthritis patients. However, the best outcome appeared when the heat therapy is combined with exercise, weight management, patient educations, and physiotherapist interventions. Conclusions. To conclude, infrared radiation is a valuable physiotherapy modality for managing osteoarthritis. It works by producing superficial heat, leading to vasodilations, pain reductions, muscle relaxations, improve joint mobility. While it does not cure osteoarthritis, it can significantly improve comfort and function when used appropriately and combined with exercise therapy. Thank you.
Yes, we fall on the infrared radiation. That is an adjunct therapy. We can use it as electrotherapy modality to improve the comfort and to improve the soft tissue mobility. So in future, if you see any cases with the osteoarthritis, if you have the availability of infrared radiation, use that modality and bring a protocol with a good exercise therapy exercises also included in that condition. Hope you all enjoyed this video. I'll catch you in some other video. Thank you.